Hola, muy buenos días a todos. Soy
Good
Sebastián Oliel.
morning, everyone. This is Sebastián Oliel at PAHO's Communications Department, and welcome to this weekly briefing given by PAHO on COVID-19 in the Americas. This briefing, as usual, will last anywhere between 45 minutes to an hour, and we will be taking questions up to that point. Also, remember that at www.paho.org/coronavirus, you may find updated information on the pandemic, as well as the latest data on cases and deaths in countries in the region. This briefing will have simultaneous interpreting both into English and into Spanish, and to choose the language, you can click on the interpretation button. We have already received questions from you via email, and you may also be able to ask questions via the chat by clicking on the Q&A button. We will also be giving you the floor so you can ask your question live, but please kindly write it via the Q&A chat so that we can organize the questions and also raise your hands. Also, please remember to include your name and the media outlet you represent. As usual, you may follow this briefing, follow the session via Facebook and Twitter. Today, PAHO's director, Dr. Carissa Etienne, will give you an update on the current situation of the pandemic in the region, as well as the public health measures during reopening. She is joined by Dr. Harvas Barbosa, Assistant Director at PAHO, Dr. Ciro Ugarte, Director at the Health Emergencies Department at PAHO, Dr. Marcos Espinal, Director of Communicable Diseases, and Dr. Sylvain Alighieri, Assistant Director for Emergencies at PAHO and Incident Manager for COVID-19. Without further ado, I would now like to give the floor to Dr. Etienne for her welcoming remarks. Dr. Etienne, the floor is yours.
Welcome, and thank you for joining today's briefing. As of June 29th, there have been 5.1 million cases and more than 247,000 deaths due to COVID-19 reported in the Americas. Our region has reported more COVID-19 cases than any other, but the overall numbers only tell part of the story. To truly understand the impact of the virus and to plan more effectively for what must come next, it is important to look beyond regional and national data and to focus on the local level. We often hear about the number of cases in large countries like Brazil, Mexico, or the United States, without the appreciation of their considerable societal and geographic diversity. In fact, multiple epidemiological curves coexist both within our region and within each country, and public health responses must be tailored to these specific situations. In Ecuador, the Guayaquil health system was completely overwhelmed at first, at a time that other parts of the country had not experienced the same degree of transmission. Outbreaks also evolved based on the public health response. This past week, Manaus in Brazil saw its first day without reporting new deaths from COVID-19 after weeks of dealing with high mortality. In the United States of America, Washington State and New York are now seeing very low numbers of new cases and deaths, while 27 other states are reporting exponential growth. Several Caribbean countries and territories were able to curb transmission completely and have reported no new cases for several weeks. But they need to remain vigilant for months to come. We must take into account this mosaic of situations and work within diverse settings to keep transmission under control. In the absence of a vaccine or effective treatments, the tools we have at our disposal are limited, and we have no option but to make the best use of them. Complacency is our enemy in the fight against COVID-19. Most countries across the Americas have implemented effective public health measures that slowed the spread of the virus and saved countless lives. But much of our region has been forced to face COVID-19 with one arm tied behind its back, so to speak. Many people live below the poverty line or rely on the informal economy, making quarantine measures difficult to uphold for protracted periods. And because our health services are not distributed equally, some communities are far better served than others. And many people do not seek care or choose to go very late in their illness because they cannot afford to pay. The personal, social, and economic toll of stay-at-home orders has strained our region, and the political pressure to ease restrictions is palpable. However, the virus cannot be left unchecked. As we are seeing, countries, states, and cities that do not embrace preventive measures or relax restrictions too soon can be flooded with new cases. This forces us to face a hard truth. We must not abandon what works because of fatigue or political pressure. This virus does not work that way. We need to double down on measures that save lives early on and to deploy them with more precision than ever before. We must let data, not passion, guide our actions. As countries that have controlled the spread of COVID-19 start planning to reopen, timing is going to be very critical. At national or at local level, we must open gradually, taking a phased approach that relies on robust surveillance, data, and expanding testing and contact tracing capacity. We also must be prepared to adjust course quickly if the epidemiological situation changes. If you have the will to relax preventive measures, you must also have the courage to pull back if infections rise. National and local governments must let transmission dynamics establish their timeline for reopening. The goal is to flatten the curve and then bend it downwards significantly before relaxing any restrictions. Transmission in your area should be going down in a sustainable way. Deaths should be decreasing and hospital bed occupancy rates should be low. PAHO works closely with countries and in many cases local governments to analyze these trends to help guide their decision making. The key is to think both nationally and locally, and to base decisions on the latest data. The more granular our understanding of where the virus strikes, the more targeted our response will be. Reopening is not merely suspending travel restrictions and stay-at-home orders. It requires implementing a set of public health measures to track new cases and build sufficient capacity to detect and control new outbreaks. These steps include the ample access to timely testing for every suspected case and their contacts. We need tests, but we also need test results to be reported quickly to paint an accurate picture. The isolation of cases. Anyone with symptoms should have the guidance and support needed to reduce the chance of transmitting the disease to others. Contact tracing. This should be in place wherever possible anchored to a strong primary healthcare system that can help reduce the risk of transmission among vulnerable communities. Tracking health systems capacity. We must ensure that the number of hospital and ICU beds remains sufficient to provide care to severe cases. The ample access to information and PPEs. This includes access to PPEs for health workers and the training to help them reduce their personal risk. And implementing travel measures to limit new infections. This could include screening travelers, case finding, quarantines, and other measures that must be adapted to each context. We also need to proactively address the inequalities in our region that limit access to health services for so many people. The most vulnerable will need economic and social support to enable them to protect themselves and stop the chain of transmission in our communities. PAHO has supported countries in every aspect of the response, providing guidance, training, and supplies. Over the past 2 months, we have donated almost 5 million PCR tests to the region and procured more than 10 million tests on behalf of our countries. We made some 54 shipments of PPEs to 26 countries. The battle is tough, but it's far from lost. There is still much to be done, and our region has the willpower, the solidarity, and the tools to bend the curve of COVID-19 and to keep it down. Let's make the most of the data and public health interventions that we have at hand. The Americas are now the center of the response to this pandemic, and we will rise to the occasion. Thank you.
Thank you very much, Dr. Etienne. Muchas gracias, doctora Etienne. Vamos a comenzar ahora.
And now we will move to the questions that we have received via email, and then we're going to move to questions from the chat that we are already receiving. Remember to use the Q&A button and indicate your name and media, and we will take questions as they come. The first question has come from several journalists in the Caribbean, and now in Jacqueline Charles' chat from the Miami Herald, and it says,
in particular, that currently are not experiencing an increase in cases and are planning to reopen soon. Dr. Etienne?
Thank you for this question. Like I said before, several Caribbean countries and territories have been able to curb transmissions and have not reported new cases for several weeks. Many of these islands took strict actions from the very beginning, including lockdowns and border closures. They also implemented public health measures to strengthen diagnosis, early case detection and isolation, contact tracing, and quarantine of contacts to avoid the spread. As expected, however, their economies have been severely affected, and they are planning to reopen their activities. But they need to remain vigilant for months to come, as positive cases among repatriated nationals as well as visitors are being observed. So to support effective decision-making, these islands will need timely and reliable data to help them identify new outbreaks early and to adapt responses in the face of changing scenarios. While an active risk of transmission remains, they must also prioritize early detection of suspect cases, laboratory testing, contact tracing, and quarantine as the foundation of a targeted and sustainable strategy to control COVID-19. Furthermore, in countries highly dependent on tourism, resuming non-essential international travel by air and sea will require additional measures by operators of conveyances at points of entry and in the hospitality industry. Arrangements must be based on scientific evidence, on global, regional, and national epidemiological situations, and most importantly, on the capacity of their national health system. Resuming non-essential international travel in a progressive and orderly way, and this requires the harmonization of policies and practices among countries worldwide, as well as the timely and clear communication of those policies and practices to the public. As I said before, a plan to reopen has to be in place, but countries must also remain vigilant and modify their measures if transmission increases and if health services risk being compromised. Thank you. Over.
Gracias, doctora Etienne. La siguiente pregunta.
Thank you, Dr. Etienne. The next question is from Sarah Nui from The Telegraph. The question is in English.
Of a combined flu and coronavirus pandemic, and what would it mean for South America if it is hit by a double whammy of flu and coronavirus? Could this push hospital over the edge? Dr. Aldiguieri?
Thank you for this question. So effectively, we have a COVID-19 pandemic, and we are expecting the influenza epidemics, the flu season in some countries of this continent, and mostly in the context of the winter season in the countries of the southern cone, Chile, Argentina, Paraguay, Uruguay, and the southern state of Brazil. Yes, we are concerned regarding possible co-circulation of influenza viruses and COVID-19, and we have made some recommendation to the countries for strengthening their surveillance. Countries are not starting from scratch. During the last 10 years following the previous pandemic, influenza H1N1 pandemic, the countries have made a lot of investment in terms of influenza surveillance. All countries and some territories have national influenza centers. It means a national reference laboratory for surveillance of influenza. And there is an important network of surveillance among countries of severe acute respiratory infections. And also the flu surveillance includes influenza-like illnesses. So the message from the beginning of the pandemic in 2020 was, the message to the countries was to use the existing platform to do the COVID-19 surveillance. All countries are using molecular tools, PCR machine, and were able to include COVID-19 in their surveillance. Why we are concerned regarding the potential co-circulation epidemics of influenza together with COVID-19 is that what we know from the last 10 years, 15 years, 20 years is that influenza epidemic can have a huge burden of health services in mostly in the south of this continent. There are thousands of deaths reported every year caused by influenza among people, among mostly people with risk factors. So what we have done during the last month, in addition of strengthening the surveillance, is also assisting, supporting countries to get the vaccine in order to implement very strong campaign of influenza vaccine among first the health workers and also people in group at risk. What we have seen now, this is the beginning of the winter in the south of this continent. What we have seen at this moment is a very low transmission of influenza compared to existing important outbreaks of COVID. So what we are we want to insist is that keep doing a strong surveillance, Keep monitor your indicators of intensive care unit occupation, and keep implementing public health measures, because the social distancing and wearing masks will also protect the public from getting infected by the influenza virus or influenza viruses. And thank you.
Gracias, doctor.
Thank you, doctor. And the next question comes from Sebastian Boyd from Bloomberg. And it said,
high levels of test positivity compared to more developed countries. Does this suggest that the levels of infection are higher than official data show? Could countries be doing more to identify positive cases? Dr. Barbosa?
Thank you, Sebastian, for this question. The Americas was the first region in the world that had almost every country able to perform PCR tests. The Pan American Health Organization provided tests to every country, and you also deployed all the kits that the countries needed to use to perform PCR tests. PCR tests are a key tool to detect the cases, to trace the dynamics of the COVID-19 pandemic. But as you know, during a certain period of time, many countries in Latin America, they had to struggle to purchase the PCR tests because many producers had sold all the PCR produced to some developed countries. So we didn't have equitable access to PCR tests for 2 or 3 months. Even in developed countries, I think that you can remember that during the acute phase, when they were facing the peak of the transmission, they were limiting the tests to more severe cases. So we need to compare Latin America now with the situation that these developed countries had 1 or 2 months ago. But you are correct that we need to improve the access to tests. If in one country we are having a very high rate of positivity, this is a clear indication that we are not testing all the suspect cases that we need to test. So for this reason, PAHO has, as our director mentioned at the beginning, we deployed for the most vulnerable countries in the region around 5 million PCR tests so far, but we also used the regional purchasing mechanism that we have, the strategic fund, and on behalf of countries, on behalf of 24 countries of the region, we have purchased so far almost 12 million PCR tests. And we are available to the countries that wanted to increase the purchase of tests to support them, because for sure that to have a capacity to test every suspected case is key to control the transmission. Thank you.
Gracias, doctor. La siguiente pregunta.
Thank you, doctor. The next question comes from María José Núñez from El Seminario, Universidad de Costa Rica. Question is, how do you assess the situation in Central America? Has Central America become an epicenter of transmissions out of control? Dr. Espinal? Thank you very much, Maria, for that question. Latin America, the region, including South America and Central America, is going through a severe phase, and it is the epicenter, not just Central America, because South America is in a tough situation as well. However, there are differences. Central America is a region where we can see countries with a very high GDP, such as Panama, Costa Rica, but we have also countries whose GDP is still very low. GDP per capita, that is, such as Honduras or Nicaragua. And we also have different levels of human development index. In other words, inequalities are widespread in Central America, and the countries must continue reinforcing their actions even if they decide to reopen. However, there are some practices in all countries that are working. We can see in Panama or El Salvador have testing programs, like Dr. Barbosa said a couple minutes ago, that are excellent. They are making the tests available to the population. And this enables us to have an idea of how big of a problem it is. And that is why Panama is showing more cases. But it doesn't mean that the one that have more cases is the one that's doing the worst. Dr. Etienne also referred to the situation in Nicaragua. We don't even know how many tests Nicaragua is performing. So it is very important to have that information. Guatemala and Honduras must increase testing because that's what's going to give us a clear picture of the problem. And also to continue with non pharmaceutical measures to the extent possible, social distancing, using face masks among health workers and the sick, and the use of face masks in the population as a whole when necessary. We can't generalize and say that it's out of control. We believe that the efforts made by the country, if they implement these measures and keep them, even if they decide to reopen, they may be able to control the virus and we will be able to flatten the curve. However, we're not quite there yet. We're not quite at the time where we can ease those measures. So it's important to continue working, and that's why we have PAHO, and that's why we have PAHO to help the countries in Central America so we can flatten the curve as soon as possible. Thank you. Thank you, Dr. Espinal. The next question is from Miguel Velázquez from Despacho 505 in Nicaragua. And it says, in Nicaragua and other Central American countries such as Guatemala, we have cases where family members of people that died due to coronavirus have said they are skeptical as to whether the bodies that were given to them actually are those of their dead uh, family members. They said in hospitals in Nicaragua they deny, and they deny to show the bodies. They give closed coffins with an order to bury them immediately, citing risk of transmission. What actions can the countries implement so that the family members are sure that the right body was given to them? Dr. Ugarte, this is a very important question. The staff that's in direct contact with the bodies, both at the morgue as well as in funeral services, implements the right protection measures. And this mechanism should continue until the people that have died for some infectious reason can reduce the risk for the rest of the people as well. However, it is very important for family members to have access to their loved ones, especially at that time. So, authorities must take all the precautions necessary for the family members to be able to see their loved ones with appropriate protection equipment, because failing to do so can generate situations like the one described in the question. And those lingering questions will remain with those people forever. Therefore, we must make every possible effort for close family members to have access to the dead bodies with the necessary protection equipment. And if that is not possible for a variety of reasons, then we need to provide them all the possible information to their family members to ensure that that one person given to them is indeed their relative. So, with that, we will also reduce the long term impact that the death of a loved one has and ensure that those lingering questions disappear as soon as possible. Thank you. Thank you, doctor. And now in the chat room and via mail, we have received questions from Brazil by Felipe Guaglio, Contedeo Globo, and in the chat from Guilherme Bianchini from Estadão in Brazil. Felipe Coaglio asks,
said she is concerned about the reality of viral contagion in Brazil by Brazilian leader. Please, I'd like to understand the concerns that PAHO has about Brazil and how Brazilian authorities are leading the problem. And Guillaume from Estadao, he says that Brazil has been 1 month and a half without a Ministry of Health, and how does this affect the fight against the pandemic in the country? Doctor Espinal, puede tomar esta pregunta.
Bien, muchas gracias por las dos preguntas.
Thank you very much for both questions. And in connection with the first one and the comments made by Mrs. Bachelet, for PAHO, it is very important to see the work that is being conducted at the country level with the workers, with the health workers, and also the measures to be implemented. PAHO has consistently called upon Brazil to increase the tests and also to send a consistent message, because once again, we recall once again that in Brazil, the governors do have the power to implement measures and they are doing it. But if there is no consistent message with international regulations or international decisions, population gets confused, and PAHO is concerned about that. Our office in Brasilia is constantly available to the authorities to help, but Brazil has an army of health workers who are highly competent at the primary health care level and also tertiary level, also excellent academic institutions. It is not just one person and a comment or a comment. We need to look at this from the point of view of a country that has a very important role to play as to the management of this epidemic. The primary healthcare service in Brazil is one of the best ones in Latin America and around the world. So it has to be used better. As to the question about a minister, there is an alternate minister, and this is not just a minister. We are referring to this army of health workers who are devoted workers, social workers, nurses that are helping the population. And finally, it is necessary for Brazil to continue to offer tests, and also we should not make this general or throughout the country, because there are some units, there are some areas that do not have the same level of the epidemic as we see it in Rio de Janeiro or Sao Paulo, the federal units. So it is important to put it in context. The message does need to be consistent, though, and Brazil needs to continue with the measures as recommended by the organization and also as recommended by their own scientists, epidemiologists, and also governors who are implementing the mitigation and containment measures. Thank you. Thank you. The next question is by Ana Lucia Ola from Prensa Libre, Guatemala. She is saying that during the development of the pandemic, it has been clear that men are more vulnerable to transmission of COVID-19, and they are the ones that have the highest risk of having a severe presentation of the disease as compared to women. Is there a medical explanation to this situation? Dr. Barbosa, thank you very much for the question. This is something that is being researched. We have several hypotheses. Some have to do with the difference in the immunological system in men and women, and also the role hormones play in the case of women. And in all countries, this is a situation that we have identified. That is to say, there is a higher rate. There is a rate of 60 to 40, 55 to 45 men to women. But it is important that when we refer to a higher likelihood of severe cases, we're not saying that women are exempted, but it is very important to have everyone who have any
risk factor for serious diseases such as older people and also people who suffer from hypertension, cancer, heart disease. They need to be alert from the very beginning of the appearance of the symptoms because they may lead to a very severe case in the short run. Thank you. Thank you, Dr. Jarbas. The next question is by Andrea Gentil from the Noticias Journal in Argentina as to contact tracing. Her question is, how can we strengthen contact tracing in the short run? Are there any strategies to do so in countries such as ours that do not have health systems to do so? Dr. Alighieri, could you please answer this question? Thank you for the question. Contact tracing is a key activity for research. The moment we have a confirmed case, we need to investigate and follow or trace contacts. That means to quarantine those persons, those individuals, to monitor their health situation, their signs, and if the case becomes a suspect case, then the patient is admitted to a hospital in isolation. As to the current tools, that also includes new IT tools. We are also emphasizing in many countries the use of computer systems to view and organize information, and we're also highlighting or emphasizing the importance of macro data, and this is being used in several countries, and Go data as an application to follow these cases. Without an efficient contact tracing system, it will be impossible to interrupt transmission, and this is a key tool, as I mentioned, or a key step, as I mentioned at the beginning of my intervention. Thank you very much. Thank you. The next question is by Angeline Montoya, Le Monde. What is the evolution of the epidemic in the Dominican Republic? Were sufficient measures implemented for the polls to be for the election to be held on Sunday? The Dominican Republic implemented initial measures that had a positive result in several areas. First, to enhance health services. Second, to increase the number of tests, and also social distancing. Clearly, the Dominican Republic has been in contact with several international actors, such as the OAS and PAHO, to implement the right measures for the elections to be held. We need to consider that the Dominican Republic has increased the number of tests to almost 2,000 a day, and that resulted in a positive test rate of 25%, and that is also linked to the response provided by Dr. Jarbas. There are some measures that need to be taken into account in the short term to be able to get to the election day in the best conditions, and for transmission to have diminished as much as possible, and for the population to be as aware as possible regarding measures to be implemented at the population level and also at the individual level, so that their right to choose the authorities is not impacted by the epidemic in the Dominican Republic. And also based on the exchanges that we have had, we understand that the Dominican Republic is implementing the right measures for the elections. Thank you. Thank you. The next question is presented by Valeria Roman. I don't know, Valeria, where you can ask your question live. Hello, Sebastian. Thank you very much. This is Valeria Roman from Buenos Aires, Argentina. My question is the following. Even though in Latin America and in the Caribbean, we have seen an increase in the use of masks outside the hospital area, I'm talking about the regular mask, I would like to know whether PAHO is recommending to establish a specific rule in each country to promote the use of masks. In case you think that that rule should be implemented or that policy should be implemented, could you explain why? Thank you, Valeria. Dr. Espinal, could you please address this question? Yes, thank you, Valeria. This is such an important question. PAHO and WHO recommend the use of surgical masks as a priority for inpatients as well as health workers caring for these patients. The second group includes people who self-isolate themselves and people who take care of these self-isolated individuals. And in those cases, there is also a recommendation to use the masks. The recommendation to use the masks in the general population and also in indoors includes to use the use of masks of a different material so that surgical or medical masks may be used in the hospital setting and for those persons who self-isolate themselves. As to the recommendations by international organizations, they are generic and they are adapted by the countries. We have promoted the use of masks of different types of fabric, and this is for the general population. But if a country decides that they need to order the mandatory use of a mask of a specific type, we cannot say that this is a policy from the organization. If a country decides that the mask has to be used, the population of that country has to comply and use it. And the recommendation is to use masks of a different type of material and in particular indoors. But we are going beyond the use of masks. We also need to think about the gatherings, large gatherings and hand washing. This is just a package, it's a whole package. We should not just think that we are going to solve the problem by using a mask, by wearing a mask. We need to think of pharmaceutical measures, PPE, and also the wearing of these masks, but at the same time, hand washing. So there is a whole package that has to be implemented. And if we follow the recommendations, we will be in a situation to flatten the curve of this epidemic. Thank you very much. Thank you. Another question here in the chat is by Melina Ochoa from One TV Mexico. Her question is, what is PAHO's opinion regarding the handling of the epidemic in Mexico? And do you think that the reopening will lead to a surge of COVID-19 cases? Dr. Barbosas, you have the floor. Thank you. Thank you very much for your question. Mexico is managing the pandemic in consonance with the recommendations by PAHO and WHO. Currently, the Secretariat of Health has established differences in connection with the various areas within the country and the level of the transmission, as well as the capability at the service level. They have implemented a traffic light system to be able to identify the risk as low risk or extremely high risk. Based on the classification of the Secretariat of Health from Mexico, no state has a green light that is low risk. So they do need to monitor the situation And the decision as to initiate the reopening of the economy, as the director has just mentioned, Mexico, Brazil, Peru, Chile, every single country has the same recommendation. First, they need to control transmission. If transmission continues to rise, and if they move to the reopening of the economy, the idea is that transmission will increase even more. So if they are able to control transmission, that's when they are in a situation in which they can cautiously plan to monitor the situation with all of the indicators, because if the transmission surges again, they need to implement the right measures. So they need to monitor each state and to look at cumulative cases. In the situation from February up to date includes cumulative data, but they need to look at each case, what is happening over the last couple of weeks, to see whether this is increasing or whether the measures that have been implemented are being effective to reduce, to control transmission. It is also very important, and Mexico is also implementing the effort to increase their testing capability, because for proper surveillance of all of the suspected cases and confirmed cases, it is important to increase testing capability, PCR, and this is something that PAHO is currently working on with the Secretariat of Health to increase their testing capability. Thank you. Thank you very much. The next question was sent by Daniel Collins, TN23 Guatemala, and he's saying, in the case of Guatemala, traditional or ancestral medicine used by Aboriginal or indigenous peoples does not imply access to the traditional medicine. And what is the opinion regarding the use of this type of medicine for the treatment of COVID-19? Thank you very much for the question. I'd like to respond both aspects, traditional medicine and indigenous people's medicine. There is a clear line between both elements. COVID-19 is a new disease. As to the objective for the research is to decrease the mortality rate, but so far we have no specific treatment for COVID-19. We have some progress that has been made with current medicines that could help survival of the patient in specific situations that we have mentioned. And I think that we mentioned this twice over the last 2 weeks, that is the use of dexamethasone that could help reduce mortality among critical patients that are receiving oxygen therapy in the ICU, including respirator assistance. So we do need to take into account that critical patients of COVID-19 have already suffered some damage, including kidney problems and an impact on their kidney function. The use of untested methods should follow a very strict protocol. We do not have any evidence on the use of traditional medicine of these for these indigenous populations, indigenous peoples in Central America. But I would like to also build upon this question to refer to the management of the epidemic context among the indigenous populations in the Americas. There is a real need for the authorities, for the civil society to have a conversation. We do need an association of these indigenous peoples to define and implement prevention activities, including situations in which very strict infection control is needed. We are referring here to, for example, the wakes to take care of the dead. And all of this has to follow all of the rules that govern infections have to be applied to these rites and funerals. So as to be able to reduce mortality, to promote treatment and rapid treatment for those that need hospitalization, but also to reduce transmission levels with the implementation of culturally accepted health measures such as social distancing and hygiene measures. Thank you very much. Thank you. We have other questions related to Guatemala. Oscar Garcia from Prensa Libre is asking whether PAHO could indicate what is the forecast for Guatemala since cases are now exceeding 17,000, whether you're expecting a peak, and also from Factor 4, they are writing to us that for a 17 million population, how many tests a day do you think are recommendable? Well, Guatemala is currently facing an increase of cases, but the follow-up based on the latest adjustments show that they are on the right path. And also the number of tests implemented are also reaching the level required, but also prompt information of the test results is needed, and also to use that information for the provision of health services as well as adjusting public health measures. It is necessary to monitor those areas where we see new cases and also to promptly isolate confirmed cases, have them quarantine, also in the case of the contacts, and also follow up with public information so that the public implements the right measures and we can diminish transmission. So I think that we can only solve this problem in Guatemala if we work with all of these measures together. Thank you very much. Elisa Martins, she's a journalist with O Globo Brazil, in the chat is asking us about the restrictions indicated by Europe for travelers from the Americas as they reopen their borders, and this is mainly in the case of the population or travelers from Brazil and the US. Is this a valid restriction? Dr. Ugarte. Well, there have been restrictions implemented by countries that have an impact on travel. When the airspace is reopened, we had already mentioned that several measures need to be taken into account. Most of them are domestic measures, but if we look at the most useful measures from the point of view of international travel, we have to think of the follow-up of those travelers who are about to travel. That is to say, those who are asymptomatic or those that show some sort of symptom before traveling. Any individual that could be in a situation that has led to some sort of contact with the sick person and that person starts experiencing some symptoms should cancel the trip. It is quite important to implement those measures at destination. People who arrive at the country need to know that once they have symptoms, they do need to go to the healthcare centers. And if they come from an area with high transmission, they do need to implement measures so that they do not expose others to the disease. And I think that this will increase the safety, but this has been a decision that is to be made by each country individually, and this will be reported to PAHO based on the regulations based on the rules under the international sanitary regulations. Thank you, health regulations. Thank you. The next question is by Ángela Valdivia from La República in Peru. She's saying that quarantine is coming to an end tomorrow in most areas in Peru. What are the measures to be implemented beyond the curfew for this new stage in the country? Dr. Espinal, thank you very much, Angela. It is such an important question. The decision to reopen or put an end to the curfew is a decision to be made by the sovereign. It is necessary to respect the measures. Some measures, as we saw when another question was answered, other measures are part of this package: social distancing as far as possible, and also trying to guarantee the supply chain and also access to the supplies, and also access to clean water, the use of masks, hand washing. So if a country such as Peru, that has been heavily impacted by the pandemic, decides to reopen because of economic considerations and social considerations, it is important to implement the non-pharmaceutical measures, because this goes beyond the quarantine, to be able to avoid a second peak or a surge in the number of cases. And we have already seen in other countries that have reopened their economies. We're not saying that quarantine is the meaning of, is similar to reopening, or that we need to reopen with quarantine. But if they reopen the economy with these pharmaceutical measures and also with epidemiological surveillance and access to testing by the population, as well as mechanisms to isolate and detect cases, as well as to isolate and investigate or trace contacts, we think that they would be able to maintain their path towards a reduction or a flattening of the curve. We will continue to have cases, but if a decision is made to reopen, we should have the necessary mechanisms to avoid a second peak, which we have seen in countries that have reopened earlier. Thank you very much. Thank you. We are coming to the end of this session, and the next question is the following.
Americas is still the epicenter of the pandemic. How does PAHO envisions the future for the region? Doctora Etienne?
Thank you for this question. So yes, the region of the Americas is clearly the current epicenter of the COVID-19 pandemic. Projections that have been calculated by the Institute of Health Metrics and Evaluation of the University of Washington, IHME, for the region estimate that by October 1st, 2020, there will be more than 627,000 deaths, almost 3 times what we are seeing today. Latin America and the Caribbean is expected to have more than 438,000 COVID-19 deaths. A note of caution, however, models have important limitations and should not be taken as literal expressions of the future, but merely as a planning guide and to give guiding elements for decision-making processes. The IHME estimates that under the current conditions in South America, countries such as Chile and Colombia will be seeing their peak of cases between now and mid-July, whereas Argentina, Bolivia, Brazil, and Peru will see it at some point in August. In Central America, countries like El Salvador, Guatemala, Honduras, Mexico, and Panama are projected to see the peak of cases in August, while Costa Rica may see the peak in October. It is important to reemphasize that these projections will come to pass only if the current conditions remain. So this means that countries can change these predictions if they take the right decisions and implement strict, proven public health measures. So in the next 3 months, we will still see more COVID-19 cases and deaths in our region. Each country will need to adjust and coordinate their COVID-19 response based on increasingly detailed data, and we've spoken about it today. Governments will have to make decisions considering simultaneously health, economic, and social factors. And flexibility will be key to adjust public health measures as well as social protection efforts to minimize the impact of the virus, particularly in communities heavily dependent on the informal economy. We also have to be aware that other challenges may arise during this time. As I said before, flu season is coming to the South and can make things more complicated at the health services. For instance, if we don't continue to maintain our immunization programs, we may see outbreaks of vaccine-preventable diseases like measles and diphtheria. Also, TB, malaria, and dengue cases could sharply increase during this period if we don't keep up with prevention and care. PAHO is committed to work with our countries to strengthen their health services and their response to each of these challenges. We do this through our country offices, our regional technical programs, and our procurement mechanisms, such as the revolving fund for vaccines and the strategic fund for medicines. We are in the midst of the fire, but I am confident that we can confront this epidemic and we can keep our people safe. Thank you.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. We have now come to the end of this press conference. Thank you all for connecting and participating. We will be sending you the opening remarks by PAHO's director as well as the recording of the session. We have not been able to answer all of your questions, but please send us an email, mediateam@paho.org, and we will be answering your questions promptly. Thank you very much and see you next week. Greetings.